Hey, Katie Kleber with Fresh RN. It's awkward asking patients about suicides, isn't it? Especially if you don't work in a mental health facility, but it's on your screening staff, right? You have to ask everybody those questions. And sometimes people say yes. How should you respond in those moments? So, my husband is a professional counselor and has been for over a decade, or he's worked in mental health for over a decade. And I asked him, hey, when people say yes, what is your normal talking point for that moment? Because the textbook says one thing and it doesn't feel very organic and natural, like two humans talking to each other. It feels very robot-y, And what is the natural talking point that you have? So one of the things that you can do that to preface those kind of awkward questions is, hey, you know what? Your safety is really important. And many things, including medical issues, can cause emotional distress that can lead to thoughts of suicide. So I'm going to ask you a few questions about that, if that's okay. And then you'll ask whatever your questions are. I'm sure your hospital has very specific verbiage that you need to ask. So I'm not going to, that differs from hospital to hospital. And so let's say that they say, yeah, I have those thoughts. The next question is, do you have a plan? And say it in a very curious, kind tone, not a, oh my God, do you have a plan? But hey, do you have a plan? And then when they tell you the plan, let's say yes, I do have a plan, and they tell you the plan. Then the next thing we want to know is, do you have the means to carry out that plan? Like if they say, I want to shoot myself, or I'm going to take a bunch of pills, we want to know, do you have access to a bunch of pills? Do you have access to a gun? We need to understand that, especially if this is, someone who can go get those items very quickly. So we want to ask, those are the next questions. But then let's say they say yes to all the things. Then a good talking point that he had was, part of the reason we ask this is that life is really tough. And when people feel like they're not able to be safe, we want to surround you with people who can help support you and keep you safe. And that is so important because your life is valuable and you are important. Okay. So we're going to do some things here to keep you safe because that's a priority to us because you're important. So when we're talking to someone who's talking about this kind of stuff, it is important to frame our interventions and what we're going to do as a way to keep them safe, because that's what it is. Okay. It's not punishment. It's not more work for you, so you're frustrated that you have to do it, but it's ways to keep them safe. And I think that if you can frame it like that, and hey, we're on the same team. I want you to be safe. We're going to do what we can. Okay. We're going to keep you safe. And I'm here to do that with you. Okay. I'm with you all shift. Okay. And I just said, okay, like 10 times. But so I think that that's an important way to think about it. And it is awkward the first few times that you're in the situation like this, but it will get easier. And the more confident you are and comfortable with yourself and in your own skin, the more authentic the interaction is going to be. Because remember, at the end of the day, you're a human taking care of another human, and they're having a really hard time and they need some support. And you are a wonderful person to provide that support. So thank you, nurses. Thank you, students. I hope that helps. Subscribe, follow, get on my email list, all the things. Thanks, guys.